Great. Thank you for joining our State Technical Assistance webinar. We are excited to talk to you today, and thank you so much for spending some time with us this afternoon and early morning for some of you. We are funded, the Children's Safety Network is funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. We are the HRSA's primary vehicle for technical training and technical assistance on child safety. And nothing from this webinar should be construed as the official policy or position of the government. Just some tech tips as we get started. Please feel free to chat in or ask questions at any time. If you can and you are able to, we would love for you to turn on your video camera so that we can see your lovely faces and really increase our connectedness on the call. Please mute yourselves when you're not speaking, but we do encourage you to unmute yourselves and speak and participate in our discussions. If you could please rename yourselves if you haven't already. I see a number of folks have already done this, but please rename yourselves with your state abbreviation and your full name. As you just noticed, we are recording this call, and we will be posting this along with the slides on our site. And if you'd like to turn on your captions, you can click on the ellipsis, the 3 dots icon at the bottom of your screen, and select captions to turn on the automatic captions. So today we have 2 presenters, including myself, but I'll introduce Christine first. Christine Silva is an epidemiologist at the Massachusetts Department of Public Health. And as the director of the Massachusetts Maternal, Infant, and Early Childhood Home Visiting Program, Ms. Silva is responsible for all operational aspects of the Massachusetts MIECHV, including program operations, implementation, and adherence to federal grants and reporting requirements. She previously served as the program epidemiologist responsible for conducting analyses for the purposes of program monitoring and development, quality improvement, and evaluation of MIECHV. She is charged with demonstrating program effectiveness and measuring the impact of services for statewide evidence-based home visiting models. She received her BA from Boston University and MPH from Boston University School of Public Health. And she's also a certified Lean Six Sigma Black Belt. And I will also be presenting, for those of you who don't know me, my name is Maria Cotratis. I am a training and technical assistance specialist for the Children's Safety Network at Education Development Center. And I'm a co-manager of the Child Safety Learning Collaborative. I'm the content specialist for suicide and self-harm prevention and poisoning prevention. And I also manage and analyze data, provide training and technical assistance, and present on a number of topics, including quality improvement and evidence-based and evidence-informed strategies. I will be speaking to you today about, we'll both be speaking to you today about SMART goals. So this is the first of a series of QI 101 topics, and many of these topics are coming out of our direct interactions with states, either in the Child Safety Learning Collaborative or in our technical assistance. So we do encourage you to share your needs and your ideas with us because we are trying to be as responsive as possible to our audience. So today we'll be talking about establishing SMARTIE aims. And to do this, I want to remind everyone, especially if you're new to our audience, I see a number of new names and some returning names. So we want to remind you all of our CSN framework for quality improvement and innovation in child safety. So the large pie on the left side of the screen, the purple pie, includes child safety expertise, leadership and management, and systems improvement. And these are the activities that we try to do in our technical assistance. So by providing technical assistance on these 3 components, we hope that the most immediate outcomes are workforce development and improving injury and violence prevention systems, and that the ultimate outcome is to improve health impact. And underpinning this entire framework is a commitment to health equity. And so if you've joined some of our other state technical assistance webinars, we just had one in January on health equity. and you'll hear about health equity throughout all of our work. We also have a number of resources on our website on specifically on health equity and working in health equity in child safety systems. So I wanted to provide some parallels between what we provide in the Children's Safety Network and, of course, HRSA's Title V Performance Measure Framework. And this is leading up to your state action plans. We know that states are working on their action plans, on their reporting for previous years. And I wanted to show you those parallels. So I will be mentioning some of the work that we're doing in the Child Safety Learning Collaborative, and then some of the more general work that we do at CSN. So every periodically in CSN, we actually go through your state action plans across all of the states to see what each state has been has indicated as their priority areas. And so the performance measure framework is really helpful in this. And you'll see the framework starts with the ESMs and goes up to the NOMs. So we'll talk about each one. So the national outcome measures that are all the way on the right are those big picture goals of really reducing the morbidity and mortality. Your national performance measures, and then also the state performance measures, are the selections of what you're actually going to be doing. And then your evidence-based, evidence-informed strategy measures are those day-to-day programmatic measures. So I'll go through each one of them just so that you have an idea. We know that a number of you are involved in this planning, and in this reporting in your states, and some of you may not be as familiar with it. So we wanted to provide that parallel here. So as I mentioned, CSN as a team, we go through your state action plans to see what are your priority areas. And so these are the national outcome measures that we find most often correlate with the work that we do in the Child Safety Learning Collaborative and in our general TA work around child and adolescent injury and violence prevention. So we have National Outcome Measure 9.1, which is infant mortality rate. We have 9.5, which is sleep-related sudden unexpected infant death rate per 100,000 live births. Then we have National Outcome Number 15, which is child mortality rate, ages 1 through 9. 16.1, the adolescent mortality rate, ages 10 through 19. So if you're familiar with a lot of our resources, these are the ages that are generally addressed. And then 16.2, specifically adolescent motor vehicle mortality, ages 15 through 19, and 16.3, adolescent suicide rate, ages 15 through 19. So programmatically, you may be working on different age groups, but these are the numbers that are reported for the outcome. These are the ages reported for these national outcome measures. And then as you go into your performance measures, these become a little bit more specific. So for National Performance Measure 5, for example, under safe sleep, there's the percent of infants placed to sleep on their backs, percent of infants placed to sleep on a separate approved sleep surface, and percent of infants placed to sleep on without soft bedding or loose bedding, or soft objects, excuse me. National Performance Measure 7 is injury hospitalization. So you're really looking at that non-fatal injury for both children ages 0 to 9 and 7.1, and then for 7.2 is that non-fatal injury for adolescents 10 to 19. And then in the Child Safety Learning Collaborative, we also address bullying prevention. So that's under National Performance Measure 9, which is the percent of adolescents ages 12 through 17 who are bullied or who bully others. So just to give you an idea of how we're going from those national outcome measures, and we're going down into then what you're actually doing. So you do have the opportunity to also indicate your state performance measures, and these often reflect your priorities from the previous 5-year needs assessment. And this is where we start to see some more indications of specific social determinants of health equity, any organizational changes that you might be doing, workforce development, and other priority areas. So in selecting national performance measures, you may be selecting priority populations. And so here's are health equity, where health equity really comes in, and these are used in annual reporting. So I wanted to bring us back to the framework. So we're looking at we're looking at systems improvement, we're looking at leadership and management, and then that final piece, the child safety expertise, is in evidence-based and evidence-informed strategies and measures. So your evidence-based strategy measures should be related to your national performance measures, and we want these to have evidence of effectiveness, of reach, feasibility, sustainability, and transferability. So what does that actually look like, and where do we get this information from? So CSN has these amazing change packages that we've created over the years, and they're all publicly available. So Liz has entered a link. This QR code goes to the same place as the link that Liz entered into our chat. We have a number of different types of change packages that are available for you to download and use across different topics. So here's an example of an organizational level change package on motor vehicle traffic safety. We also have comprehensive change packages on, this example is of poisoning prevention. And we have outcome measure worksheets that can help you with each of those comprehensive change packages. So we offer these on our public website, so you can use them to look at evidence-based and evidence-informed strategies. And if you're working in our Child Safety Learning Collaborative, you have those comprehensive change packages that are specific to the Child Safety Learning Collaborative at your disposal. We do offer technical assistance on these. So if you're not part of the Child Safety Learning Collaborative and you want some help in deciphering what you can use for your state action plans in identifying those evidence-based and evidence-informed strategies, you can take a look at our change packages and then contact us if you have any questions. Those outcome measure worksheets are really great for you to think through which data sets are used for your state or your jurisdiction, who's responsible for that in your system, and exploring the data that you need and how you'll use it. Yes, thank you, Jenny, for the reminder. So we do use this Child Safety Learning Collaborative as a place to test and update our change packages that are then later released to the public consumption. So the poisoning prevention change package that you see on the right is from a previous iteration, and so is the motor vehicle traffic safety change package that you see up there. These are from previous iterations of our learning collaboratives. So we vetted them. We had states actually use these change packages, provide us with feedback. We've updated them based on what worked and what didn't work within the Child Safety Learning Collaborative, and now those are publicly available. So you can please go ahead and check those out, and please let us know if you have any questions. So those questions that under the ESMs that you want them to be feasible, you want them to be sustainable, it really starts to make you think about our SMARTIE goals. So we like to have SMART goals. We know we've been talking about SMART goals for quite some time, but we're really looking at SMARTIE goals right now. So I'll just quickly go over all of this, and then Christine will take you through a specific example. So we want our aims, to be specific, to include a clear and well-defined system, what and where and who, the population that you're working with. We want them to be measurable. This includes quantitative goals, like by how much are you going to change this? We want the aims to be actionable within your sphere of influence, what, when, where, and how, realistic and ambitious. How is this aligned with your organization's priorities, the why, and that you have the time and resources, the how. They're time bound. They should include a time frame by when results will be achieved. They should, and here's the IE, the inclusive, that incorporates those most impacted in the way that shares power, how, and the equitable seeks to address systemic injustice, inequity, or oppression. So we really want to be thinking about this. And I will pause here for any questions or any discussion around this. I see Jenny also entered another tidbit in the chat. Your work includes aims, larger desired outcomes, and goals, more specific objectives within the aim. All right. I don't see any questions, but thank you, Liz. So if you do have any questions or would like to request technical assistance from CSN on those change packages and looking through your ideas for your state action plans, please go ahead and reach out to us. So without further ado, if you do have any questions, please go ahead and put them in the chat and we'll answer them after Christine's presentation. But I would love to hand it over to Christine to take you through an example from the Massachusetts Department of Public Health. Thank you, everyone.
Thanks, Maria. Can everyone hear me okay?
Yes.
Okay, perfect. All right. Hello, good afternoon, good morning, depending on where you are. My name is Christine Silva. I am the director of the Maternal, Infant, and Early Childhood Home Visiting Program at the Department of Public Health, which is also a HRSA funded initiative. And I want to talk to you all today about moving from data to action and operationalizing the Massachusetts DPH Racial Equity Data Roadmap to help you get there. And that includes the development of SMARTIE aims. So I will talk you through an introduction to the roadmap, which is a tool that as you're thinking about your state action plans and any quality improvement initiatives, I highly recommend going through it. It has been invaluable to our home visiting team at the department, and we'll talk through some examples and get some practice doing some SMARTIE aims together. So next slide, please. All right, as we're going through the presentation today, I invite you to think about this one question as we're here in this space. What challenges have you experienced using data to address racial equity? My hope is that through this session, we'll give you some tools to address some of the challenges that come to mind for you. This is the question that motivated us to develop the DPH Racial Equity Roadmap, which has been really central to how we've operationalized equity-centered performance management and quality improvement into our MIECHV program in Massachusetts. Next slide, please. All right, before we begin, I want to just share some key definitions that really guide our work and the roadmap. I want to note that in Massachusetts, in our home visiting initiative, we are leading explicitly, but not exclusively, with racial equity as we approach our equity work. So these are some of the slides or some of the definitions that I want you to keep in mind. We recognize that some or many of these terms may be referred to by another name or may have a different definition or function in your agency's programs or even in your personal lives. Therefore, when we start talking about SMARTIE aims and looking at data, we always start with sharing definitions to make sure that we are all aligned as we approach this work together. Next slide, please. All right, so what is the Racial Equity Data Roadmap, or affectionately known as our roadmap? So this tool offers a suggested methodology for how to assess progress in addressing inequities in service delivery and health outcomes. So although it follows the pattern of a road, it's really not meant to be a prescriptive checklist or a rigid algorithm that has to be followed step by step. Rather, it's a collection of guiding questions, tools, and resources that can be customized to best suit the needs of programs with varying levels of capacity in data analysis, quality improvement, and racial equity reframing technique. So we've used the roadmap in various DPH programs in Massachusetts. It is currently kind of the backbone of a HRSA MIECHV Innovation Award that we are doing in Massachusetts. And it's also the focus of a CDC learning collaborative. So we work to get it out there and have it tried out in different settings and different audiences. And we're currently working on updating the roadmap to address feedback from programs who have used it. So we are adding new tools, increasing the focus on engaging community, and adding examples with programs who have varying levels of data capacity. I was one of the epidemiologists that was on the team of developing the roadmap with other epidemiologists, but now it's been implemented and operationalized in programs that don't have epidemiologists or specific data staff. So we really wanted to get this out there as a tool that can support programs at varying levels of readiness. Next slide, please. So here is what the racial equity data roadmap looks like. There are varying steps. Starting with applying a racial equity reframe, assessing program readiness to use racial equity data reframes, disaggregating and assessing data for inequities, contextualizing data, prioritizing strategies, developing an equity spotlight to highlight the data, and moving from data to action. So as we are thinking about SMARTIE aims, we're going to get some practice on steps 3 and 7 of the roadmap today, which highlights the fact that you don't need to go in order. It really is meant to meet programs where they're at and help them get to their goals. Next slide, please. All right. So before we jump into some specific examples, I do want to share just a quick overview of the Massachusetts MIECHV program, or MIECHV in general. So MIECHV supports pregnant people and parents with young children who live in communities that face greater risks and barriers to achieving positive maternal and child health outcomes. So these are early childhood programs for pregnant and parenting families. In Massachusetts, we see through different evidence-based home visiting models, we see kids through kindergarten completion. So really focusing on that around 0 to 5 age range. They're voluntary free programs that families choose to participate in, and then they partner with health, social service, and child development professionals to set and achieve goals to improve their health and well-being. Next slide, please. And through this evidence-based programming, we aim to improve maternal health, prevent child abuse and neglect, reduce crime and domestic violence, increase family educational level and earning potential, promote children's development and readiness to participate in school, and connect families to needed community resources and supports. Next slide. So those are what we call our benchmark areas. They are the general areas that we are focused on demonstrating improvement. And then there are a number of performance measures that we report on data annually. So similar to Title V, we have an annual performance measure structure, and we are expected to demonstrate improvement and keep meeting these performance measures. So as you can see, there's a lot of overlap with the work you all do, where we have a number of measures related to safe sleep, child injury, child maltreatment. So injury prevention is really front of mind for a lot of home visitors and a big part of what we do. So as we have these performance measures, we generally set SMARTIE aims to help us meet our improvement goals. So Maria already, next slide, please. Maria described what SMARTIE SMARTIE goals are, we use kind of a different spin on it in Massachusetts of just using different words for the S. So our slides say strategic. Maria's slide said specific. They're one and the same, that they do need to be specific and strategic. So pick the S that helps you reach your goals. But our SMARTIE aims are really ground us in what we do. So before we start jumping to solutions to improve our performance measures, we need to understand both the problem, think about why we're seeing certain patterns in our data, and then the goal, like where do we want to be? Goals are a really concrete way to drive results, but without an explicit equity and inclusion component, goals won't produce better outcomes for marginalized communities, address disparities, or create belonging. So to center equity in your performance measure processes, I challenge you to consider developing SMARTIE aims for your projects. And again, SMARTIE stands for strategic, measurable, ambitious, realistic, time-bound, inclusive, and equitable. So by incorporating an equity and inclusion component to your SMART goals, you can make sure that your commitment to equity and inclusion is anchored by tangible and actionable steps. So the first question we ask when we're thinking about SMARTIE aims is, what are we trying to accomplish? So your response to this question helps to clarify which improvements you should focus on to get your desired results. The response will be the basis for your SMARTIE goal. And then your SMARTIE goal and your responses and how you're conceptualizing this should include any specifics about the process that needs to be improved to achieve your desired result, any particulars about the situations or the people affected, timing considerations, so having clear deadlines and parameters about what you expect to change. And then in this step of thinking about SMARTIE aims, you also want to add specific numeric goals to your statement. So think about how much improvement can we expect, for whom, by when. Your aim should be bold, realistic, clear, concise, measurable, and most importantly, meaningful. Like it's important to have kind of the passion and the reason and the overall why behind your improvement efforts. So there are two equity considerations in this step that will help you with thinking about a SMARTIE aim. So when you're thinking about what you're trying to improve, consider in which population and also who is experiencing what barriers. Those are two questions that I find really helpful as we're thinking about the inclusive and equitable portion of a SMARTIE aim. Next slide, please. All right, so we moved from SMART to SMARTIE aims because it helps us move towards intentionally and meaningfully including the marginalized communities that have been marginalized in a way, towards intentionally and meaningfully engaging communities that have been marginalized in a way that shares the power, shrinks disparities, and leads to more equitable outcomes. Next slide, please. So here's an example of a SMART versus a SMARTIE aim related to child injury. So in this example, programs identified that rates of child injury are higher in families who identify as Hispanic. So they looked at their data and identified something that they want to explore a little further. So program one set a SMART goal in response to this finding. And program two set a SMARTIE goal. So how might the outcomes from each program differ based on their approach? And what might that impact be? And please feel free to use the chat, come off mute. We'd love to hear some thoughts on what you think would happen. between program 1 and 2, depending on these different aims. Right, so I see Terry says more impact with number 2, which is the SMARTIE aim. Would you mind sharing why you think there might be more impact? What feels more impactful there?
This is how we play on this training. When you put a comment in the chat, then you get called to talk. So I was expecting. I mean, it's obvious that if you are more targeted with your goal, you have a better chance of making a difference. Sorry, I'm looking off to the side. I've got it on a bigger screen, but yeah. Yeah, it's just more specific goal. Also, you're engaging the population where you see the data pointing towards the need. So yeah, much smarter.
Yeah, I was just going to add, I think that the way you're going to get there seems more focused. And when you have that more focus, then you don't have 10 different people trying to do 10 different things. And you can really understand what your change, what the impact of the strategy that you were focused on really has as well.
Yes. That is such a great point, and something that I emphasize a lot with our home visiting programs, because I imagine that you all in your programs probably feel a similar way, that they're just really busy and things never seem to quite get less busy. So when they think about SMARTIE aims, I remember a home visitor said, like, wow, like we can just focus on what matters. And because we engaged the community, we know what'll work and we're more confident in our next step. So that saves us a lot of time and a lot of resources. So yeah, that's a really excellent point. Thank you. Julie, I see your hand up. Oh, I can't hear you though. I don't know if that's just me.
Oh,
now I can hear you.
okay. I just plugged it in more, so hopefully that helps. Okay, I was just saying I appreciate the conversation in this presentation. It's very helpful. I did just want to make the point. I'm one of the Title V epidemiologists for Illinois, and one of the things we struggle with all the time is that the SMARTIE aim, the one shown on the right here, is not actually going to correspond with any of the NPMs, for example, that are proposed or required by Title V. And secondly, we often struggle, even in a larger state like Illinois, with enough data to be able to measure something like a child injury rate in a specific racial or ethnic group. So that's, something to just kind of keep in mind, is that we can have the best of intentions, but it's not going to correspond with the Title V measurement structure. And, we often have a hard time actually measuring impact in some of these smaller groups.
That is such a great point. And I will say that I did use child injury as an example, but we also have really small numbers in Massachusetts for child injury in our home visiting program. So disaggregating doesn't shake out in practice as neatly as this specific example. But what I would say is that there's room for alignment with making a SMARTIE aim regardless of what the topic is. And we're going to talk through an example that might feel a little more relevant to Title V in just a second. But I'm big on quality improvement. So even thinking like small numbers and what can you do by next Tuesday type of SMARTIE aim setting does help in just getting practice, so it doesn't feel so big and maybe like might not map directly to an NPM, but pieces of your work could contribute to the overall NPM. And I see another hand up.
Nikita, would you like to share?
Yeah, sorry, I could not find my unmute button, which happens when you're multitasking. I'm eating lunch. I apologize for being off screen. I just wanted to add or just throw it in the mix that I love the SMARTIE goals just because it definitely takes out the guesswork. I think sometimes when you have long-term projects like the one that I work on where you have so many things you're measuring, and having a SMARTIE goal really helps you focus on what, as you mentioned, Christine, what's next? What can I do in the next couple of days? What can I do in the next month? What can I do, in the next year, or however that measures? And I also think it gives an opportunity for you to assess the partnerships that may be needed. So I'm just looking at this SMARTIE goal. We know that with that, they're targeting Hispanic communities. If you don't have that connection, you don't have that, have anyone on your team that is working with that community specifically, this definitely opens the door for opportunities. I know a lot of organizations don't always have that capacity, but I know within my role that I would see this as an opportunity to figure out, how do I engage with that community? How do I engage with the grassroots organizations that are doing that work in that community, and see how we can align our work to reach this goal.
Mm-hmm. Great, thank you. All right, thank you all for engaging in the conversation. This is great. All right, let's move on to the next slide. So now that we've talked about what a SMARTIE aim is and kind of the benefits of a SMARTIE versus SMART aim, let's talk about how to put this tool into practice and then really start moving from data to action. So this slide represents kind of how I think about SMARTIE aim development and a general process flow. So we start by reviewing the data. So in MIECHV in Massachusetts, we are disaggregating all of our performance data. That doesn't mean we don't have small numbers. We have some very small numbers sometimes, and I try not to let that get in the way of thinking about data, because even if it's just one person, something could have been done differently to help support that one person. And let's talk about it. When I say disaggregating data, what I mean here is that data are broken down and analyzed into smaller units. So looking at data by race, by ethnicity, or by zip code, rather than presenting an overall rate. This allows us to see how outcomes can be different between racial and ethnic groups or specific communities. So after we've reviewed our data, now we broadly define our goal. Think about, where do you want your performance to be? I find this like really thinking big, not getting like too stuck in the SMARTIE framework, really helpful as a way to guide discussions in the next step of actually setting a SMARTIE aim. So once we have our SMARTIE aim, we then implement a change to help us get there. And then after the change is implemented, we continue to monitor the data and make adjustments along the way to sustain our gains and ensure that we are advancing equity in our performance measures. Throughout all of these steps, it's important to engage key partners. And by partners, we mean anyone who's responsible for any aspect of the SMARTIE aim, those impacted by the SMARTIE aim, and generally those with other some sort of vested interest in the overall project. All right, next slide, please. Okay, so now we're going to go through another MIECHV performance measure example. And we're going to get an opportunity to practice together. So MIECHV funded home visiting programs are required to collect and report data related to safe sleep for our annual performance reporting. So similar to a Title V reporting on safe sleep. The specific performance measure for safe sleep is focused on increasing the percent of infants enrolled in home visiting that are always placed to sleep on their backs, without bed sharing, and without soft bedding. So this measure is based on parent self-report, and all three components of the measure must be reported to meet the conditions of the numerator and to improve in this performance measure. In practice, we ask this safe sleep question every 2 months from birth to 12 months of age. So the next slide is just looking at some sample data. And this is an example of how data could be disaggregated by ethnicity. So again, disaggregating the data ensures that any trends across the wider population are not masking trends for different subgroups. So you'll see at the top, we are looking at data from October of 22 to December of 23. We have data for those percentage for those who identify as Hispanic, non-Hispanic, and then an overall rate. And we have a goal line of 75%. So on the chart, the Hispanic performance is in orange. Non-Hispanic is yellow, overall is blue, and the goal line is the dashed line. So what do we notice about the data? And again, these are sample data. But do you notice any patterns, or if these were your data, what would you wonder about?
I think I would wonder about like is how communication is going with the Hispanic population versus the non-Hispanic, because it seems like the numbers are actually trending down or staying stable versus the non-Hispanic population. So I wonder if maybe language barrier or the type of literature that's being provided is of concern.
Okay, great. It does look for Hispanic. We actually started in October at 61%, and in December also ended at 61%. So there was some fluctuation over the year or so, but definitely not an improvement. What else do folks see?
And I don't know if it's clinically significant or not, or statistically significant, but sometimes it appears like when it's going higher, or the higher rate in the non-Hispanic, it's having the opposite effect in the Hispanic. So it kind of drops a little bit lower. So I don't know if there were like certain interventions that were happening at that time. So it seemed to possibly have more of an opposite impact on the Hispanic population, maybe. I don't know.
Yeah, that's great point. And just from a quality improvement perspective, one of the things I love about quality improvement is that we are not worried about statistically or clinically significant differences. The data don't need to be perfect. Just want to use it as a tool to kind of guide our next steps. Yeah, the non-Hispanic population increased from 70% to 94%, and it seems like it was a steady increase over the course of this time frame. Any other reflection? So one of the things I want to note about this example is, like, if we were just looking at the overall data and not the disaggregated data, we could, we started at 66% and ended at 78%. So we could say, hey, we met our goal of 75%. There's nothing else to do here, right? And it could be seen as, an overall program accomplishment, which it might be. But looking at the data by ethnicity, it seems like something worked for the non-Hispanic population, but did not work for the Hispanic population. So looking at these data, what would a potential SMARTIE aim be? And this is where I do want to hear from you. Use the chat, unmute, and I'm going to be taking notes, and we're going to kind of brainstorm and workshop a SMARTIE aim together. I can get us started. I'll say by December 2024, what happens next? And there's no right or wrong answers here. And this is exactly the process that I take when I'm setting SMARTIE aims with my team of, we just need to get some ideas on the table and then start writing something, bring it all together and refine it. It's a good way to get team buy-in too and make sure we're all aligned.
Christine, I think it's interesting that I've looked at a couple of aims that some of the members of our CSLC have already started to create. And it's interesting that I've seen it both ways. So maybe just sort of throwing it out there for people to consider that, like, what comes next? That I've seen states both focus on we're going to like increase the rates of a specific population. But I've also seen it that we're going to reduce the percent of disparity between two populations. So, I mean, I'll just kind of throw that out there to get people thinking.
Oh, I love that.
And you may have noticed a cow in the chat from Jenny.
Yeah.
So the cow is a reminder that measuring for the sake of measuring is not a strategy, that you can continue to weigh your cow every day with the hopes of it getting heavier, but if you don't actually change an intervention to increase the food intake or do something different with that cow, just weighing the cow every day or measuring the cow every day does not actually change anything. So just a reminder for us that there needs to be some actionable piece in there.
I love that. I might borrow that, Jenny. That's great.
Also, I think an interesting reframe on that, what people are thinking is the idea that like measuring the cow and seeing the cows getting bigger is not a result of measuring the cow. When people are, you know, maybe
Absolutely.
perhaps sometimes not wanting to acknowledge the data that is being shared. It's not the measurement that is causing the change. It's whatever is contributing to that change.
Good reminder of outcome versus process or proxy measure.
So our folks are being a little quiet today, and I don't know if it's that they're struggling with this topic or not, but I'm specifically looking at some of our CSLC folks because we know that you're a chatty bunch. So, oh, there we go. I didn't have to call on anyone. So, Cassidy, would you like to unmute or if you're able to?
Sure. So I was trying to think of, you know, something that isn't necessarily data, but would impact the data. And so I'm thinking of like an outreach campaign specific to maybe the most disparately impacted. So the Hispanic group, like launch an outreach campaign. I don't know, that's just kind of like the very rough draft framework.
Do you mind if I ask you a few follow-up questions? Will you entertain me with this journey?
Yeah, sure.
Okay. All right. So you will launch the outreach campaign specific to the Hispanic population. What what do you think the impact of that would be? Like looking at if you ended the year at, let's see, 61% for safe sleep, what do you think you could get to, or reasonable improvement would be?
In a year time span, I always err on the side of, like caution, so we'll say 59. We'll get it from 61 to 59.
Actually, I was wondering the same thing, Christine, when I looked at this to begin with. This is people that are following safe sleep practices?
Yes.
Okay.
Great.
Oh, so we want to
wanted to go up. Yeah.
We wanted to go. Okay, so let's do 61 to 65. I feel like positive trends are a little bit easier to accomplish.
Okay. Okay, yeah, we hadn't, because I also want you to, be ambitious with it. But we haven't hit 65 at all within the year. So the max seems to be 61. So I would say, like, based on the year, that seems ambitious. And also maybe realistic to where we are. How would you make it inclusive?
I think, the first thing that comes to mind is you have to present it in culturally appropriate ways, whether that's, like where you're marketing at, the language barriers. That's the top of my head answer.
Okay, so the campaign launch will have culturally
inclusive, appropriate.
Okay. And do you think it would be possible to have Hispanic identifying people informing the campaign?
So I definitely think that if we're looking at this from like, what is the state level doing, we would give greater, we would value in the application, maybe award more points or something like that to an applicant that has a Hispanic workforce or is already doing work in the communities we're trying to reach.
All right.
Christine, there are a couple of good ideas also coming up in the chat.
Let's see. Reading outreach materials in English and Spanish. Yeah, could find a Hispanic champion to message the campaign.
And Jen took a whole stab at just doing the aim. Way to go, Jen.
This is great. All right, by 2024, reduce the percentage of disparity between the Hispanic and non-Hispanic mothers that report they were provided education about safe infant sleep by their healthcare provider by providing safe sleep education resources to pediatricians serving the largest percentage, top 10 of Hispanic pregnant mothers and infants. That's great. Include Hispanic identifying parents who have already adopted the safe sleep practice to a peer-to-peer practice type of approach in the campaign. So this is great. And I will, the one piece that I think, Jen, you did a fantastic job. I was just, maybe we could look at this together. If we could advance to 2 slides forward. Yeah, okay, so let's look at this. Is it strategic? I would say it's certainly strategic, and I love that, like going to the pediatricians, serving the largest percentage, like the top 10, like all about that was very, very specific and strategic. I would add a measurable component. So saying from 61% to 65% could strengthen the SMARTIE aim. Because you want to make sure that like by the end of this time frame, you want to know, did you get there or not? So having that numeric component is really important. That also helps you make sure that you're ambitious and realistic. We have the time component by 2024. I always ask our programs to get really specific because that can be kind of motivating of like, oh, it's almost December. We had our goal. Like, where are we? And then your inclusive, let's see. You could add an inclusive component there, building off of what Ainsley suggested in the chat of including Hispanic identifying parents to launch kind of that education resources. And I think it's innately equitable by the way you framed it and kind of reducing the disparity. Helpful to add how you'll measure it. Yeah, you guys got this. Parents and caregivers. I like that suggestion, Melissa, of making it more inclusive by saying parents and caregivers instead of mothers. That's a really important point. And I will add another example that I had been drafting before you guys started speaking up and coming off mute and in the chat. So you can see this can look a few different ways. I think the important piece is to keep in mind is like getting some ideas and conversation going, writing it all down, and then kind of crafting it and using this this checklist style tool of like, okay, we have something that we all agree on. Let's go through and make sure we hit each key point. And then looking at it again and say like, is there a way that we can make this even more inclusive? Like Melissa's suggestion of changing the language from parents and from mothers to parents and caregivers. So it's a continuous process. It does not need to be perfect. And it's important to just engage key partners in the process. Think about this as a team and work through it together. There's a lot of learning to be had. All right. So feel free in the chat to talk about how you plan to incorporate, or as you're wrapping up, incorporate a SMARTIE aim in your work. My contact information is in the slide if anyone has any questions. And thank you all. This was, I appreciate your engagement, and I'll pass it back to Maria.
Thank you so much, Christine. This was a wonderful discussion, and I would do encourage you to check out the resource that's in the chat shared earlier, and thank you all for engaging with us. If you have any questions for Christine, please feel free to reach out. You can always reach out to us at any time for technical assistance. If you can follow our QR code or the link that Liz entered into our chat, please provide us some feedback on today's event. We do incorporate your feedback, as I mentioned earlier today, and we do try to be as responsive as possible. So if you have any ideas for future state technical assistance webinars, anything that you're struggling with or think that other folks might benefit from, please feel free to enter it. We'll be happy to do that. So thank you again, Christine, for your wonderful presentation on this workshop. And thank you all for spending an hour with us today and for your commitment to child safety. Thank you, everyone, and have a wonderful afternoon and happy spring.